Can I just give some context before we go into that conversation? And I'm going to let Nafisa take over about how we support them. But when we came in, I did some number crunching and I looked at the NMC register. And considering how much the NHS prides itself on diversity in its workforce, we recognise that actually that 20% diversity isn't in all fields. Midwifery and ambulatory services, so in ambulance services and in midwifery, we have the least representation when it comes to ethnic diversity in comparison to any of the other fields. So that is something to recognise in regards to health inequalities, because those areas have high risk, emergency, urgent triage care occurring all the time. So when we talk about triage and we talk about how people access support and help, the communities we're talking about often have an internal mechanism of triage before they call for help even. They've asked their mother, they've asked their sister-in-law, they've asked their mother-in-law, they've asked the partner, they've asked the neighbour down the road who had a baby 2 years ago. They've talked about all of these problems with everyone else before they've even picked up the phone. And then if we, as triage, midwives and services are saying, oh, take 2 paracetamol, lie down, give me a call in 2 hours and let me know what's happening, we're delaying care further. We know that if people are unwell, the worse they are, the harder it is to get them back to baseline. And that's more likely when mortality and morbidity is going to occur when people are really unwell. So early intervention is key. Better than intervention is prevention, but early intervention is key. And if we're not having representation in these services where people who are from these communities say, oh, well, should we just bring them straight in? Should we just, if someone's got a language barrier, rather than trying to have a conversation over the phone where we're struggling, let's just bring them straight in, because what could be going on? We are going to have these issues come up. So the numbers, when I was coming back to it, I've gone in a roundabout way, haven't I? So it's one of the things that when you're neurodivergent, your brain bounces around. But coming back to the numbers, in midwifery on the NMC register, this is dual registered at the time, only 5.5% were from Black, African, Caribbean communities. So that's not compared, if you compare that to national statistics, what the national Black population is like in the UK, that's underrepresented. And when it comes to South Asian communities, only 2.5% of those were Asian, South Asian, Pakistani, Indian, Bengali, are midwives and dual registered nurses and midwives that were on the NMC register. So that, in comparison to the 12.5% national representation in our national demographics, is extremely underrepresented.